So this is Dr. S. M. Goel, MD Medicine, DM from top medical schools in Delhi, and also MD USA and DM USA. In this video, I'm talking about cancer and the guidelines of. I'm talking about cancer and the guidelines. Two things here. One thing is, suppose somebody mentioned that you have a cancer and you know very well. I asked my team, they almost feel, oh my God, it feels like your life is over or you're gonna die soon or near future. Obviously, that's not true in this day and age. I will make a separate video about that. But right now, let me mention that top medical bodies finally, after tons of research all over the world, they have come with the guidelines for screening of the cancer. Cancer has 4 stages. If we can catch it early, which is stage 1, when cancer is there but is very very local and 100% treatable, and we can 100% get rid of cancer. So at certain ages, before that we have realized that cancer is very very rare, but after certain ages it dramatically increases. So I wanted to tell you about most common cancer we screen is like for the women, we obviously increase for the breast cancer, and we start screening each year starting at age 40. Well, after actually every 2 years starting at age 40, but after 45 we start screening every year. And so you have to understand that I have so many patients with the breast cancer, and fortunately most of them get it caught at stage 1, and after I followed, our practice has followed them for years. They are all doing well. Then next is female cervical cancer, and we start at age 21 screening. We do a pap smear, and we do it every 3 years. I know it's a youngish age, but this is true. So, and then to continue, these are all very gold standard screening tests, which is a very good test. So, and then we also screen for colorectal cancer, and so when we talk about the female uterine or endometrial cancer, actually is the guidelines is we should screen it only after menopause. We already doing we are already screening you with the pap smear for female cervical cancer. So but after you have menopause, suppose you have unexpected bleeding, then definitely we should diagnose by the uterine biopsy. And next is the lung cancer. So lung cancer, you have to understand the people who smoke or are still smoking, and actually people who have smoked 20 pack history. It means either you smoke 1 pack for 20 years or you smoke 2 packs for 10 years. That is dramatically increase the risk of lung cancer. And then we wanna screen you at age 50 with low dose CT scan of the lungs. And people who are not there yet but who still smoke, we should do everything to request them to quit smoking. And otherwise, people who do not smoke or who have quit smoking, they don't need this lung cancer screening. Especially it has been more than 15 years when they quit smoking, so before they get to the age 50. So, and next is prostate. In the males, we do the prostate test. We do PSA test. It's a blood test, and how often should be done? Basically, we decide based on the PSA, but we are usually doing blood tests most of the time every year, and then we can add PSA test. Here we do PSA test pretty much every year when we are doing the blood test, especially after a certain age. And I mean, prostate cancer screening basically we start at age 50, and then, like I said, prostate specific antigen is a blood test, and that's very good. And I get it done every year. And so basically, you have to understand that these are very good tests. They have, their data, all over top medical bodies. They recommend tests. They are very, very effective, and we give you specific age and the guidelines. Definitely, risk increases if you follow the guidelines. We can catch it very early, and then you don't. Like I said, I know so many people who were caught at stage one and early stage, and 100% doing fine, and live a long normal life. So why not you wanna take advantage of all the advances we have made? Forget about how it was 20 years ago, 30 years ago, 50 years ago. Just see how it is today. Thank you very much.